Okay, so hopefully you guys have a pretty good sense of the different kinds of sexual difficulties that you might have from last class. And we're going to talk a little bit about different ways that we can treat sexual dysfunction. One component that is really important is just understanding what's going on. Some people might not necessarily have a good sense of sexual function, and education might be sufficient for those folks to help treat whatever kind of difficulty they might be having. So, a case example described in your book is a couple with really limited sexual experiences. And they're trying to have sexual intercourse without any kind of preparation for the woman, and it's ending up being painful. In that case, they were able to successfully treat that couple's issue just by providing some education on, foreplay and other kinds of activities that a woman might need prior to engaging in intercourse. So, education for some people might be sufficient. However, some folks need a little bit more than that. And there are a number of psychosocial protocols aimed at dealing with some of these sexual difficulties. You guys might have heard about Masters and Johnson, right? These were folks that did a lot of the early work on sexuality and treatment of sexual dysfunction. They developed this really intensive 2-week program that was therapist facilitated to treat sexual difficulties. And they had a number of components to this. So they did have that education piece like we talked about, but they also had a whole lot more. So they would work with the couple to improve communication, to try to deal with maybe interpersonal issues that could be contributing to sexual issues that they were having. Then they would try to reduce performance anxiety by taking the focus off of, just sexual completion and orgasm as the goal. Because sometimes when people are so fixated on that, they can experience a lot of performance anxiety, and it can actually be detrimental to their sexual performance. So they would have people approach sexual intercourse kind of in stages. So maybe they would do something like sensate focus, which is just focusing on enjoying the sensation of touching someone, not necessarily with the goal of sexual intercourse. In fact, they were saying during this sensate focus part, you're just going to enjoy having affectionate touch with each other. So that was that sensate focus and non-demand pleasuring piece. Then they might, once they've established kind of some arousal and some comfort through this phase, move towards touching the genitals, but without orgasm. So again, in an attempt to remove some of that pressure and performance anxiety. And then people might have intercourse. So this is all, going on slowly over a period of time. And their outcomes were really successful. They had really good improvement for things like premature ejaculation, erectile dysfunction, and other folks similarly found some supporting evidence for this program. And there were like different specific pieces for, in particular, sexual difficulties. So you do like training and masturbatory procedures for female orgasmic disorder, for women that were having trouble achieving orgasm. For that penetrative pain associated with those muscle contractions for women, they would use dilators to basically get someone used to that sensation of penetration. And there was a squeeze technique, which is basically just squeezing near the top of the penis for premature ejaculation, that could be taught in this process as well. So, there's specific like little components for particular sexual difficulties that play a role here as well. You guys have all heard probably about Viagra, Cialis, and other medications. These are those that are aimed at helping men achieve erection. And they are helpful for a pretty substantial number. However, they also unfortunately have a side effect of really severe headaches. And not necessarily everyone that is able to achieve the erection sufficient for intercourse is satisfied with this medication. And the reason for that is, the Viagra and things like that address that physical component of function, but it's not touching on performance anxiety or any of the kind of cognitive and psychological factors that might play a role. So for people that still have those issues, they're going to continue to struggle even if they're able to achieve an erection. So that's a component with this to kind of keep in mind. There was some hope that a similar medication would be identified for women, that there would be like a Viagra that would help women by addressing that physiological component of arousal. But, you know, so far, except for maybe some subcomponent of postmenopausal folks, it doesn't seem to be necessarily effective. And the issue is, you know, you guys might remember arousal difficulties for women also commonly go along with low sexual desire. So, you know, if you have low sexual desire in general, you know, that's a big component rather than just that inability to physically achieve arousal, which is what, you know, things like Viagra are really aimed at treating. So not necessarily a great kind of equivalent approach for women from the sexual dysfunction treatment perspective. Other things, these are more, again, more targeting men. There are vasodilating injections directly into the penis. As you might imagine, this is, you know, something that can be painful and is not really necessarily enjoyed by everyone for that reason. I mean, if you think about, you know, anytime you want to have sexual intercourse, you have to have an injection directly in a very sensitive part of your body. It's not necessarily comfortable for a lot of folks. So a lot of people do discontinue that. There is also a surgical implant option, which is where folks get different kinds of implants into the penis to support sexual function. So this can be, you know, anything from like a semi-rigid rod that you can bend into shape, or something that's inflated with a pump that is usually placed in the scrotum. But folks are not always 100% satisfied with these because, you know, it can feel somewhat artificial and not necessarily giving them everything that they're hoping for. There is also a vacuum device approach, which is a cylinder that is drawing blood into the penis, followed by a ring to trap the blood. A lot of folks do, you know, maybe find more satisfaction from that option. It is less intrusive than the surgeries and, you know, doesn't necessarily come with that side effect of pain like the injection, so it can be an alternative approach to take for some people. All right, so that's all we've got for treatment of sexual dysfunction. We're going to move on to paraphilic disorders. So these are disorders of sexual function where folks have some component of distress or impairment, and maybe they're actually physically harming others because their sexual desire is fixated on something outside of consenting adults. So, you know, if they are sexually attracted to animals, which unfortunately commonly are dogs or horses, if there's a focus on some kind of physical object, and there's associated distress or impairment with that, like let's say they're engaging in a behavior that could be harmful to them, or if the act is, you know, just something really violent, like let's say that they are sexually aroused by, you know, physically harming someone. That's something that could be a concern. And this is not just unusual behavior. You know, we're talking about paraphilic disorders that has to have that distress or impairment component. So to give you an example, like let's say someone is, you know, really like kind of has a fetish for balloons or something. You know, and they're not hurting anyone through this behavior. They're generally able to have pretty normal general life function and they're doing okay. But they have this, you know, attraction to balloons. We wouldn't necessarily consider that a disorder. I mean, that would be an unusual kind of behavior. But if it's not hurting the person, it's not really causing them issues, they're not hurting someone else by it, we might not necessarily be concerned about that. So folks, you know, it's not just the unusual piece. There's a distress impairment component that might be hurting someone, that kind of piece to it. Sometimes people will have more than one, and it is not uncommon to have comorbidities with, substance use difficulties and some of those mood and anxiety disorders that we talked about earlier in the semester. So we'll go through some of these. Frotcheristic disorder, you guys might have heard about. This is where someone is aroused by the act of rubbing against someone. Usually this is in a crowded kind of place, public transportation, and the person is going through until the point of ejaculation. And this is non-consensual. This is, you're on a bus or on a train and someone starts non-consensually rubbing against you. So this is, obviously that's not a behavior you want people to be engaging in because other folks are not consenting to being involved there. Fetishistic disorder is attraction to inanimate objects. So it could be like rubber clothing, it could be being attracted to a specific body part, like people that are really attracted to feet, for example. And the key piece for what makes this a disorder versus just something that is a unique thing about a person is that distress or impairment piece. So if someone is stealing like women's underwear, let's say, stealing used underwear, and they're engaging in like criminal behavior to do that, or they are, inserting an object into their urethra, which is another practice that can sometimes occur for folks with fetish disorder. They're really fixated on that, and they're needing medical intervention to have that removed. Maybe they're kind of trying to block off airflow, and they're feel that sensation of choking is something that they're really interested in, and they're doing it in a way that might be harmful to them. Those are the kinds of things that we'd be worried about. If there's like some piece where we're concerned that the person could be harmed by that. Voyeuristic and exhibitionistic disorders. So these are about watching other folks or displaying your genitals to other folks. So voyeuristic disorder, watching an unsuspecting person undressing you naked. And that's a big component that is a focus for this person. Exhibitionistic is, like flashing, showing your genitals to an unsuspecting stranger. And for some of this, you might think, well, voyeuristic disorder, there's places that someone could go, like a strip club, for example, where you could watch people undressing. But that's not really, for people that are really fixated on this, that's not going to be sufficient. They're really fixated on that risk component. They don't want it to be a consensual piece, which is part of the problem, right? Like if they were just going to a place where people were consenting to this behavior and they weren't going to get in trouble for this, they weren't going to hurt anyone, there wouldn't be that impairment component. But they're doing it to folks that have not consented, so that's the issue. And that risk, seems to really be a part of their arousal. It's hard to estimate prevalence of these things. Obviously, they are not, there's legal concerns. So people are not necessarily going to be, always willing to come forth and reporting that they're engaging in this. But there have been some studies, and they found that a pretty substantial proportion of the population may be aroused by something like exposing genitals or spying on sexual activity, which would fall into disorders that could be in this family. Transvestic disorder is sexual arousal that is associated with fantasies or acting by dressing in clothes of the opposite sex. This is going to be really different from gender dysphoria, and we'll talk about that throughout this lecture, but this is basically, you're not wanting to become a woman by dressing as a woman. You are just really, this is like a sexual thing for you, and this is something that the person just likes to do in the context of wanting to achieve sexual arousal. There does have to be a distress or impairment component. So if someone is doing this and they're not necessarily having any trouble, we wouldn't consider it a disorder. And there can be a piece of joining macho organizations for men to kind of, if they're feeling embarrassed and they want to compensate and feel like they're still very masculine.